with a coming of age ritual and accompanying myth, people stay psychologically in a child's mentality where an attitude of dependency, where the expectation is that somebody will provide for me. And when they don't, there's an intense frustration and a yearning to have this need met, but not recognizing that you are now of age to meet your own needs. Does that make sense? So a lot of what Jung said was a lot of people who suffer from neurosis had not graduated from, let's say, adolescence or young adulthood into a mature adult, where they, instead of saying, "Where's daddy? Where's daddy?" "Oh, wait, I'm daddy." So you're a 40-year-old male living in your mom's basement and playing video games all day, and not really assuming the role of an adult that takes on the responsibilities of the world, and you're still kind of hiding from it. And these create all kinds of neurotic behaviors that we would currently say now are mental disorders. Now, that's not always the case. There's trauma and things the like. But this is one aspect of how these things might perpetuate, especially addictions, because addiction is a means of escape, right? We're escaping our life, we're escaping the world, we're escaping our minds, we're escaping our emotions by numbing the mind, by not a lot of times in addictions you'll see the lack of responsibility to other other things in life that we need to attend to, like maintaining the family tribe, taking care of your children if you have them, taking care of your relationships, your significant others, and things like that. And so, to get this started, I want to start this off with a myth from a poem that is an epic of Wolfram von Eschenbach that was written around 1200 in AD. And this is during the kind of French Romance period. And it was about legends of Arthurian court and, the Grail legends and Camelot and Galahad and Guinevere and all these things that we're familiar with, from movies and books and things like that. And in this epic, there's a Galahad, who is the son of Sir Lancelot, appears in King Arthur's court, and they're all kind of waiting around for some adventure to be had before they have this feast, because there's no point in celebrating and feasting if there's no adventure to be had. So Galahad appears in court on the day of Pentecost. Any Catholic or Bible study folks in here? I was in Bible study for probably 12 years old in Roman Catholic Church. So the day of Pentecost is a religious holiday that is 50 days after the crucifixion of Christ, and I'm trying to think, in 10 days after his ascension, or something like that, or before his ascension. And now Wolfram's using the day of Pentecost as a literary tool. He's saying this is a significant day that this all happened, right? And this happened, on this religious holiday, and the like. And so he's making, in these very religious times, where everybody celebrated the mass and would know that this was an important thing. And this is the shared mythos where the society understands the importance of this. Now we're kind of disparate in our beliefs, and they span different religious traditions and beliefs. So it's not I would say, homogenous as maybe life used to be, where there was a very strong cultural understanding in the community, where things are much more diffuse now. But so anyway, the Holy Grail appears in court, veiled, and in the middle, and there's this mystery about why it's here, and then it vanishes. And so Galahad proposes a quest that all of the knights go in quest of the Grail. And he says that it would be a disgrace for us to go forth in a group, that um, each one of the knights should go in quest of the Grail and choose their own path, where there's no way into the forest, where there isn't a path already drawn for you. Just kind of cut your way through, um, and to behold this for ourselves. Of course, the Holy Grail is the cup of Christ that was used at the Last Supper, and Joseph of Arimathea used to capture the blood of Christ during the crucifixion. And so he was jailed for I don't know, something at that time, and the Grail sustained him. So it had this power of immortality so he lived into the Arthurian times from the biblical times. So and the metaphor is something like the the holy or spiritual aspect of the human life, the most glorious um, object to be beheld, and of course it's maybe our spiritual awakening. And so here's a myth here that I've proposed to you folks here, and that you might be able to recognize in your own life. What is the thing that you're after? What is the thing that you're drawn to? What is the overarching theme of your life? To help people, to maybe provide from your family, to recover from the family that wasn't is all you had hoped it would be when you were in your childhood. So there's some mythological theme in there, and you can think of this as um, a metaphor for that. Okay. So when we think about these positive myths that might draw us towards great feats of success and inspiration toward with others in our community and our own life, what would you think is the myth of addiction to counterpoint that? Okay, yeah, this won't hurt. So yeah, that's almost a lie, but like the belief is, do you think people feel worthy who participate? And I'm not talking about recreational use of drugs and alcohol. I'm talking about people who are destroying their lives. Um, Brianna is asking if we're working with spirituality within the groups. Sometimes I really don't direct them to, but they may pick up on it through the stories and metaphors that I use. I don't really I want them to kind of figure that out on their own. That's not my place as their therapist. So, okay, to help you guys out here. So, one thing, the myth of addiction is that I need to have this, right? Dependency. If I can't live without this, I can't live without drinking, I can't live without using, I can't live without gambling, I can't live without repeated sexual encounters. So there's this underlying, almost obsession with this person, place, or thing, right? And there's oftentimes a lot of um, problems with self-worth, like they don't believe they're worthy of being whatever, belonging. Because you wouldn't abuse your body that way in your life if you believed you were worthy. So we'll have to, one, uncover these unspoken um, myths or rules that people have for themselves or belief systems, and then hold them up to the light and recognize, of course, everyone has inherent worth, and we don't have to use alcohol to survive. But until we've confronted those fears and think, yeah, loss of hope, I think so, that's true. There's a lot of shame and guilt. There's also a manipulation in addiction, because the substance or behavior manipulates us into feeling not feeling, right? Either feeling euphoric, which lasts sometimes, but then after a while, then you're just kind of just keeping trying to keep the demons at bay. You're not really enjoying the experience anymore. When people drink, a fifth of vodka every night, they're not enjoying it. They're doing it because they have tissue dependency and psychological dependency upon the substance, and it's painful not to have it. We hear this when people are recovering from heroin, that they feel sick. They feel like they have the flu, for like the worst flu you've ever had in your life. But going back, let's go back a minute, because I do think if everyone would kind of reflect on this slide here, on how things that may have affected you have changed you in a sense. Maybe I'm thinking about these kids outside playing and making all this noise and screaming for no reason, and how free they are, and how they're just at play with life, that there's no responsibility, nothing terrible has moved in yet, or they haven't experienced tremendous loss or a life crisis, which tends to make us a little bit more rigid or more serious about life. And so how these things might have changed you, and how you might recover that sense of childlike wonder. Um, yeah, Alondris, I remember taking another class, reading something about how addiction has to do with the speed of reward. Yeah, that's the drug interaction. Or gambling too, but that's kind of like the neurobiological level. I'm thinking kind of in a deeper way, because it isn't just what we find is when people stop using drugs and alcohol, they still have the same problems. They just don't have a means of escape. So we have to give them ways of living, believing in themselves, believing in their community, believing in their family, believing in that life's worth living. Otherwise, they suffer. They suffer tremendously. And so, in looking back at that, think about how life might have shaped you differently from your experiences that are challenging, and what you might like to recover. Maybe being more open, more vulnerable, more easy to laugh, more easy to cry. Not having to hide your emotions, not and share them openly. Um, so we might look at this as a stall, where this is old cars trying to. This is from a film called Owning Mahoney, where Philip Seymour Hoffman plays this. I think he's a bank clerk or something, and he embezzles like all this money from this, Canadian Imperial Bank, and he really never doesn't realize that he's addicted to gambling. And even when they confront him on it, and he's getting arrested, he's like, "I don't have a gambling problem. I have a cash flow problem. Because if I could just get more money, then I could win more money." But of course, he's already lost, millions of dollars to gambling. So. Uh, yeah. So how to find joy again, just living a sober life through trauma. Yes. Yeah. So a lot of times, yeah, we're haunted by this trauma, and then we turn to addiction, right? Because the trauma is playing on us, rather than going through the process of healing and maybe being guided and helped through it, because it is a tremendous experience. A lot of times folks will turn to addiction. And so when I'm working with folks in recovery, when they stop using, we'll start to reveal that they have all this underlying trauma that they need to process. And everyone has trauma, and then there's trauma, right? Like people have some really repeated injuries to their psyche, to their person, to their physical being, and those most of it, we're all wired to recover from this and grow from it. But when it's really beating you down, and you can say people who are overrepresented in addictions and repeated trauma, severe trauma, are, let's say, minorities, women, people who are fall below a certain SES, so people who are impoverished for most of their life, they suffer more hardships. I was in my group the other day, and I remember hearing this, but I kind of forgot it. That women, the person most likely to cause the most physical harm or murder them is their significant other. Like on like the first order of that's the most dangerous person to a woman statistically. This isn't obviously all women, but statistically is their significant other. And you think about that, how terrifying that is for a lot of women to live through. And we'll say, well, we have women's rights now, but things are still, there's a reason we have a protected class of citizens because we know these things happen, and we make efforts to kind of weed them out. Now, sometimes they fall short, a lot of times they do, but having that understanding can help prepare and protect people. This is why in Nevada, if a domestic violence is called out, they just take them both to jail. They let the court figure it out. We don't know, but we know that if we separate you two, you're more likely to survive. And I remember when I was a kid, man, it was a lot different world. I was born in 1974, so I grew up through the end of the 70s, and laws were very different. Um, and I remember people, neighbors getting. I grew up in kind of a lower middle class neighborhood, a lot of working class folks, blue collar plumbers and things like that. They might drink a lot, and if you ever did that kind of work, you understand why people are trying to escape the pain of their body because working 12, 14 hours outside in the Vegas heat is it's a lot. And there might be an argument, and the cops will be called, and they just kind of tell them to knock it off, and there might be even physical violence, and then nothing would happen. So it started to get such a problem that the legislature made changes, and now yeah, also I'm sure it does happen, but I wouldn't say it's the norm. I think the reason the laws are so strict, especially in Nevada, is because there were so many homicides by intimate partners that the legislature had to do something. So I agree that sometimes people can use the law um, to for, for other reasons than it's there for, um, and but at the same time, um, these things can end in death and injury and like that. So I think of when folks enter recovery is assistance of overcoming this stall. So and so because they've kind of lost the support of their families, maybe they all lost their job economically, they're in crisis, and they're just kind of surviving, but they have to kind of rebuild their life. And so the group can provide support for that when I'm speaking now from a clinical perspective. So how do we begin to rebuild? Man, I am having a hard time with my well, one thing is kind of recognizing where things went wrong, but also recognizing that there's a power that we can evoke from the group process. So Joseph Campbell says that man finds himself by relating to others. So when we're in group, we get to be with people who have had the same experience. Maybe they've suffered an addiction, they're in recovery, or are they just starting in the recovery process, or have they been in recovery for a long time? And that kind of that shared experience helps them bond. So a lot of times people will say, well, I remember what you were like, what I was like my first week. Just hang in there, things get better. Use the group, come to group, go to meetings, things will get better because it seems kind of hopeless. So getting folks just kind of through the door. And it's really courageous whenever we would introduce new group members. Everyone was really positive and thanked them for being there and having the courage to show up, because it does take a lot of courage, and to overcome your fear of this whole process. And you're going to change your life in a lot of ways, because a lot of times you have to let go of relationships that you might have had for a lifetime, friends, family. Maybe your significant other is addicted and not interested in stopping. So these kinds of experiences are traumatic in themselves by just going into this process of trying to let go of this pathological behavior that's been destroying your life. Even that, because you know kind of what it's like. And when people get to this, this point in the life cycle of addictions, the individual has reached a point of complete psychological isolation. This is what they might call hitting rock bottom. They've got nowhere else to go but up. So, or die. A lot of folks would tell me that. Like if I wasn't here today, I'd probably be dead. Um, Especially in problem gambling, because there's a high incident of suicide with gambling because the debt is so high. Like people had gambled away millions of dollars, and they're like, I can't even pay that off in my lifetime if I wanted to. If I worked 5 jobs forever, But there's always a way forward, and money is just money. And then because of the behaviors that might have engaged in, they might have stolen things from family members, borrowed money from friends. Um, and there might be a lot of shame that maintains their isolation and fear of being confronted by those things because they would just kind of um, continue using and not really think about it. Any questions or comments? As I know I'm kind of going kind of fast through this, but I want to make sure everyone gets a chance to. Let's see. You know, Winnemucca, Trinity mentioned that Winnemucca has a very high DV rate. Um, I think throughout Nevada it's pretty high because and of course most DV happens when people are under the influence. And not always, but I would say probably 90% of the time there's some substance involved, right? Which people kind of lose control or so one of the ways we confront shame is yeah is by helping folks understand that there's a distinction between guilt and shame. So guilt is I did something bad. Shame is that I am bad. Um, I'm sorry I did something bad, and I can recover from that. But if I am bad, then that's just there's no escaping that. But they might have been given this message early in life, like you're a bad person, you do bad things, you're going to be just like your father, you're no good. And so those messages become part of their belief system, or you could say their negative myth, right? So we want to confront those things. We want them to share that. And people say, no, you helped me after our meeting last week. You sat here and talked to me. If you were a bad person, you wouldn't have taken the time to listen to me. And you gave me a ride home because I was waiting for the bus and it was raining. And so people will give you evidence to say, no, you're not a bad person. You might have done bad things and you should feel bad about those and make amends and at least make an effort not to repeat them. But you're not just the epitome of a negative thing, right? And then, of course, secrecy that may have been a rule in the family, silence and judgment, which maintain that shame, where people are like, "I'm no good. I can't be um, I can't be in a healthy relationship. I don't know who would accept me like I am, who would want me as I am." And if anybody's ever had a chance to see Brene Brown's work, she's all over YouTube and she has some pretty good books. I think she wrote one called The Gifts of Imperfection. Um, Also, another one called I Thought It Was Just Me. And she really goes to the heart of what it is to overcome this uh, shame by confronting it, and how when it's dispelled, the antidote to shame is connection and resilience. So people realizing um, that the antidote to shame is empathy from others. So sometimes when you're in the throes of your addiction and you go into a recovery group, your friends and family aren't ready to provide you empathy. You've pissed them off. You have done terrible things to them. You might have stolen money from them or manipulated and lied to them many times. But the group can offer you a safe haven. It's kind of like training wheels to get you back on track. Like, okay, you're kind of in this, in the red, and we're going to help support you, get you back into the black. And so through that vulnerability, we allow ourselves to be seen. This breakdowns barriers to isolation, the process of healing, where you can kind of forgive yourself, which is kind of the first thing before you ask others to forgive you, and maybe forgive others for things that they have done that may have led you to, let's say your father was really abusive and he comes from a generations of families that did that, and it was just normal, and men didn't talk about their feelings, and they weren't allowed to cry, and all these kinds of things that build up um, on one another. So they're able to make connections when someone shares their story, understanding being vulnerable won't kill you, because before it was, don't share your feelings. And then recognizing that they're resourceful, that even through their addiction, they were able to make things happen. So they still have those skills, and they can seek help. They can be helpful to others. They can learn to manage their feelings and to cope without resorting to, poor choices or past behaviors like drugs and alcohol. And then not only making use of social support that's available, but being a social support to others, and then reconnecting with family and friends. And so when you're hearing all this, I want you to think about areas of your life that you'd like to improve, and how these same principles can help you in your own life. Maybe it's not addiction, but maybe there's some area of concern to you that you could overcome with these same principles, application of these principles, like being more open, learning how to modulate your emotions, learning how to speak about your emotions rather than just reacting, or overreacting. Because a lot of time, I mean, I was thinking about it when I was putting this together, and I was thinking, in the last 100 years, life has changed more than it did in the previous recorded history. So altogether, if you take like from the Stone Age, if to, let's say, the 1800s, everyone cooked with fire. Everyone, like got on an animal to get around or walked. There were no cars. Trains started coming around. There's some ships. People pretty much understood a ship. It's a floating piece of wood, and there's ways to get it around. But since then, things have exploded. Technological advances, and we still have the brain of that, you know, prehistoric man. We fear snakes and spiders and have all kinds of fears of others because when you come into different tribes, there's danger there. They would steal each other's women and all kinds of, you know, the emergence of the state and militaries and police, that stuff didn't exist always. We're talking the last 2,000 years if you're lucky. And before that, it was just kind of tribalism and things like that. So we're asking everybody who has really this genetic load that is geared towards just had a few generations to adapt. It's failing. Our adaptation's failing. So we have to come up with new methods to help each other out and help ourselves out. And I think government at large really relies on this kind of moral code for us to act right. We know that people who have had severe trauma, or let's say have behavioral issues related to mental disorders like autism or FAS, if you guys know what that is, they will get in trouble with the criminal justice system. And from an outside observer who's not trained to identify these things, they'll just say, well, this person is just a bad person. They have a criminal mind, or they don't want to adhere to social norms. But when you recognize they have other things going on, which were not through no fault of their own, like FAS is is being exposed to alcohol in utero. So you have basically permanent brain damage. And now, not to say that we don't have treatment and therapies to help recover some of that loss and adapt them so they're able to function better, just like autism has its own um, limitations that require special training. And but most of those folks just get thrown in jail, and then there's nothing for them, and they just think something's wrong with them. But now we can identify those things early on and get interventions in place. Hopefully, it's not always as easy as it looks. So teaching folks about their own shame, learning to identify it, understanding that it erodes connection, and then learning to cooperate, instead of trying to take life on your own and be on your own and take care of yourself. You learn to collaborate. This is an old photo. It makes me smile to think about. In my graduate program, in my internship, I went to Guatemala and uh, Antigua, which is the old capital of Guatemala, and there was an NGO there called Common Hope, and we went there and we served our my practicum hours there, serving the community. I was paired up with a social worker. We did house visits, and um, I think about this. I'm in my graduate program a year from graduation, and all the social workers down there, which are basically bachelor's level, they don't really have master's level clinicians there, and they're not really trained as psychotherapists. They're trained as bachelor's level social workers, which is a little bit different. And they started asking me about addictions, and of course, addictions was a my field of study, my specialization, and I realized none of them had had any training on how to deal with addictions. So they had a like I want to say it was like a dial, like a DSL modem, and in their compound there was an old coffee plantation, and we were all bunked there and stayed there together, and I just developed a curriculum on basic things to do for addiction, basic interventions, basic assessment, um, and and I told them, hey, if you guys need anything, just give me a call or email me. And they did email me a few times. And I remember going to a house, and I had been trained as a psychotherapist. I mean, I was still new, but we went to this house, and I said the baby was just kind of like walking around naked, and the woman was in dire straits. And I told her, I said, if you don't get her to a hospital or so somebody can sit with her, she's going to kill herself tonight. Like, she had all the signs. There was no food, there was nobody there. She had lost kind of like a will. I could just feel it. And so we had some neighbors come over, and then her sister was going to come over and stay with her, and then they were going to take her to the church. But uh, I could just see, I was like, and because this social worker, her name was Rosa, wasn't trained to identify these things, she was just going to do her site visit and leave. And I was like, no, we've got to do something else. This is serious here. I never forgot that. And of course, I got this image of us all. We met for coffee at this place, and um, okay. um, so the idea is that we understand that compassion, empathy, understanding, cultivate love and compassion, and and just an unadulterated, unconditional acceptance. And so when we teach folks this, they can see there's a way out, but they have to kind of open themselves up to it. I don't know if she made it out okay. I know we did get some additional support for her, but beyond that, I was only there for a while, and I didn't get to get back to that home. I'd like to think she is, but I don't know. The other thing that we're doing in group is, installation of hope. This was from an old movie that I was going to get into, but I don't have time to do. We're out of time here. That we help patients come to believe that their lives could be improved, and they find ways to decrease their suffering by making connections, by finding different ways to cope. Um, And it's important that they find some inspiration from the group process too, by being a part of something bigger than themselves. And then to also support other members who might be in despair and encourage others by their own positive outcomes. So what I'm doing here is I'm going straight through Irv Yalom's principles for group psychotherapy. Okay. And this was an important book for me. If you get into graduate school, you'll have to read it if you take that path. And there's this understanding of universality, which is a common feeling among group members, where they feel like they're no longer isolated, they're no longer apart from others. Um, they the group provides an antidote for these feelings of isolation, loneliness, being other, or kind of like not belonging. And for many folks, I remember it was like the first time they felt understood by others, and this enormous relief they felt by the recognition that they weren't alone, and really valued the benefits of group therapy. And it doesn't have to be just addictions. People can get together. People who are like, I don't know, sewing circles, or they build model trains, or it doesn't have to be pathological. It can just be a way to maintain, connection, cohesion, your mental health. The health of the community, the health of your society. Okay. And then also the sharing information. This is an important concept where um, the group members share their knowledge and understanding of their problem, and they might see somebody, that happened to me, and this is one thing that I did. And so we have this impact of our wisdom, when it's combined with one another, that leaves the group with far more knowledgeable about certain conditions when they. And I'll tell you, I learned everything I did about addictions from my group members. They taught me. And as a clinician, especially early in your career, you should be really open to the fact that your patients are going to teach you a lot more than just the scholarship and academic research that you've completed. Okay. Um, and then I remember I was on a hike. I took this picture. I don't know why. It looked like all these little cactuses were like praising the sun to me. I couldn't figure out what was going on, but it made me smile. So I try to use images from my own life experience to exemplify the concepts that we're discussing here. In this case, we're talking about altruism. So doing something for the benefit of others, just for the benefit, not with any kind of um, payback or compensation. And this is something group therapy can offer its members, the chance to help others where maybe they didn't have. They weren't in a place where they could offer support to others. Um, they might be able to offer support for folks with psychiatric problems, um, and make them feel adequate, and that there's nothing specifically wrong with them, but they're just having to overcome, a specific experience or process or feeling. And this enhances their self-esteem and their feelings of self-worth, because they're able to, no, those aren't Napalas. You wouldn't want to eat those. Napalas are like flat and tear-shaped. Um, I guess you could eat those, but I don't know. I think these actually have like a neurotoxin. I was in scouts for a long time, and I was thinking, I think I remember those things were really dangerous. Uh, any questions going forward or comments? I want to make sure everyone has an opportunity to share. Okay, and then also this corrective action where people will kind of make, they've made small deviations from their life course and they've ended up in big trouble. And now they have an opportunity to correct that path, with some guidance from the group members, from the therapist, from the whole process. The group becomes a substitute family that resembles and improves upon the family of origin in a lot of ways. We are patient, we are encouraging, we are kind, we are consistent. And of course, the group leader or the facilitator has a responsibility to maintain safety. And whenever that safety is compromised, he or she has to act, or they have to act. They have to say, hold on a second, Bill, I know you've got some strong feelings, but in order to maintain safety for the group, I want to ask you, encourage you to use a softer tone so we can all hear you and understand you without getting triggered ourselves. And other people might just scream back at them, and then they're back into their family of origin, where that's how things were settled. um, and then even though you might be the facilitator, there might be like uh, a a leader within the group that isn't necessarily ordained, so to say, but recognizing their authority in the group is really important. Like you know I know I know Jonathan really has a lot of positive things to say, and I was just wondering, what did you think about Mellie's story, and how it applies to her own experience going through? Well, oh, thanks for asking me, Oscar. When I was going through my recovery, da, 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 and so you're encouraging this thing, but you're also recognizing the gifts and attributes that other people have to contribute. So you're keeping it kind of balanced, and making sure everybody has time for the group. Nobody monopolizes it and things like that. And yeah, and Keaton said those are the most amazing people. They really are. And I'll tell you honestly, it takes a lot of pressure off me when I'm facilitating a group. I'm like, hey, I know they have something to say. All I have to do is create space for them. So this is an opportunity for us to practice pro-social behavior, listening skills, um, making ourselves vulnerable, trying on a lot of these skills. And of course, as the therapist, you're modeling a lot of these. And you can see this is over here, the little bald guy. That's what's his name? Um, help me out, guys. I don't know. It's escaped me. He's the father of person-centered therapy. Rogers. What's his first name? Anybody know? I want to say Bill Rogers, but that doesn't seem right. Carl Rogers. Thank you. Carl Rogers. Yeah. And if you guys have ever seen his videos, he's just amazing. Um, when I, we're doing our mock therapy sessions in graduate school, and so we meet with our classmates, and we have maybe a mock intake session or a mock therapy session. We're all trying to do our best Carl Rogers impersonation. And what I learned was to really just bring my personality to to be as genuine as I could. And that was going to be more useful than trying to create a persona around my therapeutic work. Because that authenticity evokes the authenticity within the other person. So the more honest you can get, closer you can to the real self, the more they can be their real self. Because a lot of people have masks that they wear, even in their intimate relationships. They've got these masks of they never really unmask themselves, and that is really what Carl Rogers' therapeutic process was, is to learn how to unmask people into a sense of trust and well-being where they feel comfortable opening up and being genuine, rather than the social mask that we've had to wear, just to function within our. He would consider that the ego, and then you take off the ego, and the ego is not you; it's just a representation of a collection of personality traits. So group members can give us each other feedback. We try to make it positive and also constructive, and then understanding how to appropriately interact with each other. Sometimes this directness can be painful. The honesty can be, but they'll learn to not overreact to, like, this is just somebody trying to be honest to help me, like a coach to help me improve. It isn't to help to turn me down. So they let go of those previous schemas or myths where, oh, everybody hates me and everybody thinks I'm stupid and nobody likes me. And so when you let go of those, you can just see these honestly for what they are. This is just something I observed, and I wonder if you noticed it too. And then, of course, we have the opportunity to model behavior, and then they can take those skills. They would watch me diffuse a situation or talk it out, and they'll say, wow, I didn't know people could talk like that and interact. I remember I had a professor at UNLV and a student, and uh, they were at odds with each other, and I was the director of the program at the time, so it was upon me to resolve the issue. I brought them in. I did basically almost the same thing I would do in a couples counseling. Like I controlled the situation. I let them speak. I didn't let them talk over each other. I maintained a calm, concerted, confident tone, but also showed concern and compassion from both sides. I listened to them. I used my active listening skills. I reflected, and by the end of it, they stood up and they're like, thanks for taking the time to explain this. It was just a big misunderstanding. They were at odds with each other. A lot of times when people misunderstand each other, they're seeing something that they're projecting onto one another, and I was able to clarify that. Not in a kind of judgmental way, non-judgmental way, provide feedback and then support, and they went through the rest of the semester. And one of the comments that the professor made was that she felt like the student was being hostile, and she was afraid. She's like, there's so much violence in the classroom. People bring guns to school and they shoot their professor because there's some problem with it. Luckily I don't have students like that. But and he heard her. He said, I'm sorry that you felt. Of course, I made no violence or harm to you, but I was offended by your comment, and I felt you embarrassed me in the classroom. And they listened to her. She didn't have to agree with him, but she heard him, and that diffused everything. And this student was already in the field, and this professor was a licensed therapist as well. And they both made a comment. They're like, "Wow, that's how it's done, huh?" And I'm like, "Yeah, I guess so." And it felt to me like a couple session, and I just used all the same skills to just get them to see each other and hear each other without losing control. Now, I'm just saying it's not as easy. These folks showed some constraint, even though they were frustrated with each other. Couples can go just like nuclear, and it is difficult to recover, even with all this much experience I have. And then interpersonal learning. So humans, we're social animals. We're born ready to connect. Our lives are characterized by intense and persistent relationships. We have families, friends, significant others, and much of our self-esteem is developed from the feedback that we get from these relationships and the importance of others. Yet we also develop distortions in the way that others see us and we see them, and this can damage our most important relationships and leave us in those feelings of isolation and disconnectedness, or feeling disconnected. And groups provide an opportunity for members to improve their ability to relate with others and live more satisfying lives just because they have adopted some new skills. Okay. And cohesion. So, belonging, acceptance, and approval among the most important and universal human needs. Fitting in with our peers as children, adolescents, pledging a sorority or fraternity as young adults, joining a church or other social groups. Um, can add like fulfilling experience to these basic human needs. Many people with emotional problems have not experienced successes as they do after group. For the group may make them feel more accepted because it's set up with kind of some guardrail, I guess you could say. The facilitators making sure that things stay kind of on an even keel, and feeling valued, maybe, and accepted for the first time can really be a powerful healing factor and open up their own heart space and compassion for others and themselves. So this going from this feeling of isolation and separateness to a sense of belonging and connectedness or cohesion. That's the bit. The group can also be a place where people can experience powerful emotions within the safety of the group. A lot of times we don't allow ourselves to release these emotions. Um, Plato talked about the theater as a place where the persona could enact these dramatic interplays and give people an experience to of catharsis during the play. So when someone died in the play, they would grieve, then the audience would grieve along with the actors, and of course this would be related to their own grieving that they might have experienced, or powerful feelings of joy and elation that might be expressed through the dramatic interplay. So we provide a space for this where people are able to learn from their emotions, opposed just to an intellectual understanding of their experience. I know I shouldn't feel this way. I shouldn't think this way, but you do, and these are thoughts and feelings you have, and so let's honor, respect them, and examine them, and increase our awareness and understanding of ourselves. So we don't force catharsis, but it can be an environment where people are ready to let go there, because that's part of the experience of groups. When they watch other people do it, they go, oh, I can do that here too. This doesn't have to make me some kind of weirdo. Okay. And then existential factors like learning certain realities of life, and accepting those, going from that child stage of belief and understanding that death exists, isolation, the meaningless of not life, in developing some kind of meaning around it for yourself, and then the freedom to be who you want to be, becoming self-aware, can relieve anxiety, being more trusting and open, that develops within the group and with the facilitator, and permits exploration of these issues, and can help members develop acceptance um, of the difficulties of reality, which is sometimes, um, I think what comes to mind is, um, like I call the Slumdog Millionaire moment, where he kind of sees all the negative and positive in life is related to each other, like one couldn't exist without the other. So almost, I guess, more mature attitude towards life. Okay, I think we're almost done here. Let me get to, yeah, we're going to stop here. There are references here to a lot of things we discussed here. I do want to give you um, the passphrase for attending this evening. So if you take that passphrase, you put it in your assignment for the symposium. You don't have to send a document. You can just put it in the text or whatever and submit that, and you'll get points for coming to tonight's lecture. And it's mythos, 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 three times. Mythos, mythos, mythos. And somebody's going to ask me again. Mythos, mythos, mythos. It's in the chat. Submit that to your assignment, and you'll get full points for coming. Folks who can't make it, oh, I think I forgot to record this. It is not going to be good. Yep, I did. All right. Well, we're going to have to do something about that. I stopped the recording early on. I was like, don't forget to start the recording. Um, that's too late for that now. So yeah, submit that in there, and you'll get your full points. If you guys have any more comments before we break for the evening, please feel free to ask away or make any comments. Thank you, Lainey. You're welcome. Thank you. Thank you. Now, this was a fun one for me. I was kind of struggling thinking what to present, and I went back to the things that have always inspired me and fascinated me. So I hope that came through. Thanks, everyone. I really appreciate your comments and your interest in these topics. And I hope everyone has a good end of semester, gets to graduation if that's where you're going. And and if you need something, reach out to me or Dr. Wentz. Thank you all. Have a good night.